At this ASH meeting, from the investigator from the Ospedale Bambino Gesù in Rome reported the results of a comparative studies of patients transplanted with an alpha-beta T-cell depleted haplo with a technique of add-back of lymphocyte with a suicide gene in order to avoid severe GvHD. So one of the main limitations of the use of haploidentical transplant in children is mainly due to the high complication, especially the GvHD and the non-relapse-mortality. Therefore, several investigators in the year investigated the use of T-cell depleted haplo with a selective depletion of alpha-beta T-cell, which are responsible of the GvHD, and to increase the relapse control and immune recovery. So in our institution, we were able to investigate almost 88 patients given an alpha-beta T-cell depleted haplo with 70 patients who had already received also an add-back of lymphocyte named Rivogenlecleucel, which are cells from donor apheresis with an add-back of caspase-9 inducible in order to prevent GvHD. So this study was conducted in our hospital, and the main characteristics of the diagnosis were acute lymphoblastic and acute myeloid leukemia, and all patients were under 18 years old. The donor were most frequently parents in both groups, and importantly the content of the cell in both groups were of more than 10 per 10 to the 6 of CD34 peripheral blood stem cell, and the number of lymphocyte was alpha-beta was 1 per 10 to the 5th per kilo. So those patients who were enrolled in the Rivogenlecleucel group had also received, after the donor engraftment, so after neutrophil engraftment, also an add-back of lymphocyte, which were titrated in a dose of 1 per 10 to the 5th, and also targeted with a suicide gene to be treated in case of GvHD. This is because the addition of the caspase-9 construct allow apoptosis of the cell when a dimerizing agent is included. So the main results of the study show a benefit for those patients treated with the Rivogenlecleucel, namely because of a reduction in non-relapse mortality, which was very low, not being more than 1.5%. And also there was a benefit in the leukemia-free survival with some important data showing also a faster immune reconstitution for those patients. So the conclusion of the studies demonstrate how the add-back of lymphocyte in a setting of an alpha-beta T-cell depleted haplo is feasible and is safe using a suicide gene in order to abrogate GvHD if it occurs.